This patient with dental phobia was referred to me for 2 teeth. Tooth number 3, patient doesn't remember how old the crown is, porcelain crown. Tooth hurts spontaneously, also hurts too cold. So we examined the tooth thoroughly and determined that tooth number 3 had irreversible pulpitis with acute apical periodontitis and recommended endodontic treatment. Patient needed to be sedated, as I said, because of her dental phobia. So that's tooth number 3. Let me show you tooth number 30 now. And this is tooth number 30. According to the patient, this root canal was done a few years ago. And take a look here. PFM crown here. And previous root canal. And look at this large lucency here. Tooth was tender to percussion, within normal limits to palpation. Probings were 2 to 3 millimeters all around. But when I see a lesion like that, I always talk to the patient about the possibility of vertical root fracture. Although the probings were 2 to 3 millimeters all around, but when it comes to a lesion like that, I always go over that possibility with the patient, just to make sure that they understand. So patient wanted to try to save this tooth. So take a look here. Let me show you tooth number 3 first. So we retreated this tooth for the patient. So we IV sedated her, of course, as I was saying. So let's look at tooth number 3 first. So this is tooth number 3. Went through the porcelain crown. Both root canals, both this root canal and the endodontic retreatment of tooth number 30, we did them again together under IV sedation. Both of them took me about an hour and 15 minutes combined. So to both of them, this root canal and the endodontic retreatment of tooth number 30, in total combined 1 hour and 20 minutes from start to finish. Tooth number 3 had 3 canal systems, and when I don't find an MB2, I say I gotta prove this to myself that there is no MB2. So I searched, and I'm sure you know by now, I use a surgical operating microscope under high magnification. In this case, this tooth did not have an MB2. But take a look here. Mesiobuccal, distal, and palatal, and look at that beautiful bifurcation in the apical region of the palatal canal there. So that's tooth number 3. Let me show you a different angulation of the tooth. Again, you can see that MB, distal buccal, palatal, and that really nice bifurcation in the apical area of the palatal canal there. And this is another angulation of tooth number 3. And the other way that you can confirm that there is no MB2 here is if you look here, the distance from the guttopercha to the outer border of the mesiobuccal root is the same as the distance from this side to the outer border of the mesiobuccal root. So you can see that this distance here and here are equal. So that means the guttopercha is centered. And that's another angulation. So we temporized this tooth and went ahead and retreated tooth number 30. Let me show you tooth number 30 now. And this is tooth number 30 after we retreated it. So I was able to regain patency, remove the guttopercha, old guttopercha, of course. I used chloroform. And look at all of this anastomosis that we were able to pick up between the mesiobuccal and mesiolingual canals. And again, you can see the lesion here. And when I see a lesion here, again, I always go over the possibility of vertical root fracture. But my goal is If this is endo causing this, there is probably a lateral here. So I make sure that my irrigation protocol is perfect, like always is, and of course sonic activation in this case. And take a look here. Let me show you what I was able to pick up here. This angulation right here, take a look. There was a lateral canal right into this lesion, as you can see right here. So I'm very optimistic about this tooth, especially since I picked up that lateral lesion there. So that lateral lesion, what it could have contributed to this lateral lucency here. And the way that works is that if necrotic tissue is in that lateral canal, and of course bacteria and their products, then of course they can cause bone destruction here and give you this lateral lesion. And the fact that I was able to clean that lateral canal and then three-dimensionally obturate it, I'm optimistic. I believe that I was able to get rid of the bacteria in that lateral canal, and hopefully we'll get healing here. But as you can see, with this tooth also, everything went beautifully. We went ahead and temporized both teeth and referred the patient back to her dentist for the permanent restoration.